So today, you guys got out of bed and decided you were going to join Tom and I for this great workshop we have put together, and we appreciate that. So Tom and I have been working with clients and Tom patients for a very long time, and over my 10 years owning a Pilates studio, everyone comes in with back pain. And so Tom and I started to think there has to be a way that we can help people who have back pain on a greater level than just seeing people one person at a time, right? So we put together this program that's 12 weeks long. It's facilitated by us, but it's putting you guys on a program so that it's a lifetime game plan for you, just so that you have ways to get yourself pain free and ways to get yourself back on track if you fall off that game plan. So, today, what we wanted to talk about, because we think these three things are probably the most important takeaways, we wanted to talk about how to decrease your pain, how to increase your movement, and nutrition. Unfortunately, a lot of it comes down to nutrition, right? So, what we put into our bodies affects everything that we do. So, I'm going to talk about that piece. Tom's going to go over how to decrease pain and increase your movement. And you guys will save questions for last. We did save plenty of time for that. Um, so we just want everyone to settle in. You don't have to do anything, just listen to us. Tom is going to show a couple exercises. So if you want to jump in and join him with those, you're welcome to do so. And again, just if you guys don't mind, just put yourselves on mute and we will address questions at the end of the workshop. Okay. So the first thing that we want to go over is nutrition. Okay. So with nutrition, anything that we put into our bodies, it's either going to absorb it or is going to try to fight it off, right? So when we put inflammatory foods into our body just attacks it. It attacks it like when you get a cold or a virus, right? It's trying to get rid of it. And our bodies are meant to do that. But once we keep putting that stuff in our system over and over and over again, day after day, our body doesn't know what to do with it. And we can't just get rid of it. So our body attacks it and it becomes a form of inflammation. And inflammation just hangs out in our body, right? So it can hang out anywhere and it can cause pain, it can cause chronic problems, it can lead to obesity and health problems like diabetes. It can lead to a whole host of problems. So our goal is to get rid of that stuff, right? So in getting rid of that stuff, we have to decrease stuff like fried foods and refined foods. Anything you would find in the kitchen, like white breads, anything that's processed that comes in a box. Like, I love eating my kids' graham crackers, but it really isn't the best thing that we should be eating anything like that, right? Anything that's like a man made food, we shouldn't be putting in our bodies when we have an inflammatory process going on, right? So you want to try to decrease that stuff. Anything like red meat, we have to try and get rid of. And probably you guys, I know most of you know this, but like pastries and hot dogs and pepperoni and sausage, all of that stuff is so bad for us. Just even on a general level, when we're dealing with pain, it definitely adds to that level of inflammation in our bodies, right? So we want to get rid of stuff like soda and anything that's artificially sweetened. You have to try to get rid of that stuff, right? And it doesn't mean you have to do it all at once, but if you gradually take that stuff out of your life, your body will feel so much better. And I can tell you this mild thing, just from my own experience. I had a back injury a long time ago when I was in my early 20s. And for some reason, that pain just hangs on right here, right? And so recently, I thought to myself, just with COVID creeping in and the decreased movement, and there's nowhere to really go, and my exercise has been off track, I was like, I'm going to do a cleanse. And so I did it, and that inflammation like went crazy for a couple of days. But then all of a sudden, I told Tom the other day, I am sleeping like a baby at nighttime. That pain has crept itself right out of my life. And granted, it's not all of it, right? Like I've tried to increase my exercise back into the picture, and I've tried to get the total picture back in my life. So that is definitely a part of it. But it was amazing to me how just that one piece has helped, right? And it's a small piece of the puzzle, but it's willing and working, and it's not hard to try, right? So the stuff that you really want to include in your diet every day is anti-inflammatory foods, right? So those are foods that help get rid of the inflammation in our body. So stuff like tomatoes in olive oil, green leafy vegetables like spinach and kale. And we like to have nuts like almonds and walnuts in your diet. Fatty fishes. So a fatty fish is something like salmon, tuna, mackerel. I don't even know if I'm saying that correctly. And sardines, which give or take, we don't all love those things, right? But the other thing is we all love fruits and vegetables. So fruits, you can do strawberries, blueberries, cherries, oranges. So in particular, all that stuff is really good for us, but the fruits and vegetables are really high in natural antioxidants and polyphenols. Polyphenols are a protective compound found in a plant, like coffee. So it doesn't even mean that you have to give up all of the stuff that you love, right? You just have to give up the really bad stuff that we shouldn't be putting in our bodies. So the bottom line is on the nutrition is we just have to try to eat a well-rounded diet, right? And get rid of the stuff that we know is not good for us. Any processed food, anything that just completely bogs our body down with inflammation, and our body has a hard time naturally getting rid of it. Okay, so that's my nutrition spiel wrap up for you. And Tom is going to talk to you about how to decrease your pain and how to increase your movement. And before he gets started, I'm gonna tell my little story about Tom and his back pain. And so when I first met Tom, here was this man who I saw at the gym every day, and I thought to myself, he was always on the mat doing these same exercises all the time. And I was like, what is this man doing? Like, he's doing straight leg raises, he's doing bridges, he's stretching every day. Like, he does hardcore, like racquetball and stuff like that. And I thought, why does he do this stuff every single day? It just didn't click with me. It didn't make sense. But, you know, we didn't know each other yet. So I just continued to observe what he was doing. And then when I got to know him, he was like, oh, I really, in my 40s, really came down with this bad back pain. And it was horrific. Like, I couldn't sleep, I couldn't walk, I couldn't do the things that I like to do. And I listened to his story and I was like, oh my gosh, he sounds like all of my clients. Like, everyone I know has this problem at some point in their life, right? And so you want to help those people, and I can help people with that stuff in the studio, but that's only helping one person at a time. And that only gets you so far. And so Tom is going to totally disagree with me on this. But during COVID, I started to see that little gimpy pattern coming back in his gait. And I was like, buddy, what's going on? Is your back pain coming back? Like, everything is slowing down and we're not getting out and exercising. And so he tells me that he didn't stop doing his exercises and he kept doing them. But I noticed that back pain was really creeping in. So he got back to those exercises, which he says he didn't stop. And he did his stretches, all of his bridges, his straight leg raises, everything he does to keep his back pain at bay. And within a couple of weeks, he was back on the right road. So I felt like over the past year, Tom and I have been working on putting this program together. It's a 12-week program, but it's exactly that. It's putting together your life in a way that you have these exercises that work for you and your diagnosis, and working on the nutrition piece. So I'm going to stop talking and I'm going to let Tom come over and start talking. Okay, you guys?
Thanks, Tammy. Good morning, everybody. I'll get back to her story and I'll probably strangle her at some point during the program, but don't worry about that. It's all out of good fun. I told her, I'll tell you my side of that particular story. And for those of us who are beyond a certain age, we get all sorts of aches and pains that those of us who maybe are younger don't actually feel yet and don't understand. You know, back pain to a certain extent is a normal part of life. And now how can we decrease it is the key. Anyways, let me back it up a little bit because I need to tell you, for those who don't know me, I just have to tell you kind of where my background is from. I do recognize some of the faces, so that's great. Good morning, glad to see you. But I've been a physical therapist for a little bit beyond 40 years. I don't want to talk about that, too many years. And most of my time frame has been, you know, in outpatient physical therapy and dealing with people that come in with back pain, not only back pain, but neck pain. And so as Tammy was talking to me about this, I said, okay, you know, we'll put together a program of everything that I know and that I've seen and that she's seen over the course of my time frame. If you've done something on all of your jobs, if you did something for like 40 years, you know at least that really pretty good. You might not know how to change a tire, how to build a deck, but you certainly knew your job. So the part that I've seen about back pain over the next 12 weeks, I'd like to pass on to you. There's a lot to talk about. So I can't do it all in one time frame, but at least we can sort of kickstart it here today. And before you leave, I'll give you a couple of key things that we want to talk about. But anyways, yep, doing it for 40 years and have a lot of fun with it. This program will be a lot of fun. And as Tammy was saying, I have had my own experiences with it because having gone through the time frame. When I was in my 20s and 30s, I had like low back stiffness. So here's a hair club for men story because I've had this. I've had back pain. Most people have had back pain. 80% of all adults at some point in their lifetime will get some form of back pain, either mild, moderate, or severe. And I hope you're one of the mild ones, but almost everybody at some juncture will have some form of back pain that immobilizes them. And you're here today because, you know, hey, what helps? And usually like in the 20s and 30s, it'll be like a stiffness, you get by with it. By the time I got in my mid 40s, I was pretty immobilized like any person who comes down with low back pain and then eventually sciatica. Sciatica means pain down your leg. That's all that it really means. We have one really big nerve in our posterior thigh in the back of our leg. And if that gets pinched upon, you get sciatica and you get it on either side. So anyways, I came down with severe sciatica so that I was limping and gimping around like many of you have if you're here today to discuss some back pain. And I went through all the things that everybody does. To my great reluctance, I went to my family physician, to the orthopedic surgeon, eventually to the neurosurgeon, tests and measures, CT scans, x-rays, MRIs, and diagnosed with a severely herniated disc. And as a physical therapist, I knew what to do. I knew how to help myself, but still pain is pain. And I called upon the different therapists in my office that I thought were good. And I did the exercises that I know will help. But it still took me a long time to it took me really about 9 months to get rid of the sciatica and to decrease the pain. And then eventually I knew I had to always keep moving because that's my job. And eventually I got a lot better and returned to all the things that I personally wanted to do, like Tammy mentioned with racquetball or golf. And so that's the Hair Club for Men story. What she was talking about is during COVID, I think a lot of us all got a lot less active. Maybe you couldn't go to the health club. Maybe we couldn't even go out at all. And so what she doesn't know is that I did stick with my exercises. After work, I would lay and do my stretches that she always saw me do my stretches. For those people who haven't really suffered through back trouble yet, you kind of know that in a way it's always with you, and then you have to find ways. And if you stick with us through the 12 weeks, you'll hear me say a lot that you have to minimize your pain and maximize your movement. So you'll hear me say that a lot, minimizing the symptoms, and then maximizing how you move is the key to sort of decrease low back or neck and get yourself moving again. And I probably would guesstimate, that's why you're here. Finding ways to decrease your symptoms and get moving again. And there's other pieces too. There's nutrition, and there's lots of other smaller pieces that go through the 12 weeks. Again, sort of the huge array of what somebody can do to help with their symptoms, how you can help decrease your pain. So anyways, I've had it myself. And as I've told some of my clients who come in, when someone comes into the office with back pain and they're really struggling, I always tell them my story a little bit because I saved my MRI. And sometimes with my name blackened out, I'll show my MRI to neurosurgeon friends of mine or orthopedic surgeons. I'll say, hey, what do you think about this case? And they always say the same thing. They look at my MRI and they go, this guy's a goner. That's too bad. He's got a bad problem. He's got a herniated disc at L1 and a herniated disc at L5S1. That's me. And so they don't know it's me, but then I'll do a little dance around them. I'll be like, hey, baby. And I go, that's me. And they're like, what? I go, I know. Not everybody that's got bad MRIs or bad CT scans is going to be all laid up or have to have back surgery. I certainly didn't have back surgery, and I always try to help people when we can to avoid back surgery. As we get in the weeks, we'll talk about why some people need back surgery and how somebody comes to that. But statistically, only 1 to 3% of the population goes on to back surgery. So most of us basically can kind of find ways to do that thing, which I said, minimize your pain and maximize your movement. I remember just thinking, just when I was listening to Tammy talk, one time when I was on, they wanted me to go on Channel 6 and talk about back pain, but they said, you've got basically like 30 seconds to summarize how you as a physical therapist can help with back pain. So we've got 30 seconds and then we'll go to a commercial. We'll introduce you. And then what would you say in 30 seconds to decrease back pain? And so I said to Liz Bishop, I said, hey, I'll have to just say the two most important things, which is postures and positions and movement. So postures and positions and movement. And that's my takeaway message for today is that what I want you to do for homework is for postures and positions. I want you to start thinking about for yourselves, because we'll get back to it down the road through the 12 weeks. What postures and positions decrease your symptoms? So you have to be a little bit of a detective, a little bit of an investigator yourself. Does sitting decrease your symptoms? Does laying down decrease your symptoms? Does standing up decrease your symptoms? For the most people like myself, like when I'm working, I feel a lot better than if I have a couple days vacation and I'm sitting around more, maybe sleeping in later. And maybe that's what Tammy knows with COVID. We did have more downtime. And so for those of us with back trouble, if you sit around more, you stiffen up. And if I'm moving around, especially if I'm on my job, I stand, I sit, I kneel, I walk. So that's when I feel the best. And when I'm sitting around, I feel the worst. But anyways, as you examine your own situation, and we'll get back to some of that individually, how do you feel when you're sitting, standing, or sleeping? Try to be your own detective. Think about that. So postures and positions, and two movements that you can really kind of start with is this. Here's the first one. Every day throughout the course of your day, a little bit. You don't have to jump out of bed and do it, but in the course of your day, stand up, put your hands on your low back, feet about shoulder width apart, and bend backward like this, because that is what we call lumbar extension. And it's the opposite of what you're doing right now. Right now, you're in this position, you're flexing. So our spine is flexing. And every once in a while throughout the course of your day, do a standing back bend. Hands on your back, feet about shoulder width apart. Take your hands and put them right back there so you can kind of almost give yourself some overpressure. When people are in the office, they'll often, after I show that to them, they go, okay, let me try. And they go, and I'll have to say, no, it's just from here to here. It's just from here to here. It's not really flexing. We do enough of that as we go along. So that's called low back extension. And it's safe for all of us to do throughout the course of the day. For some people, for some particular problems, especially if they're younger than 50, that's a really good exercise to do. For those of us older than 50, we'll get into it down the road. You have to do a little bit more flexion exercises. However, for all of us here today, this is a pretty good exercise for almost everybody. We almost do it naturally. That is low back extension. We do it naturally anyways. When you go for a long car ride and you get out, you do that right there. So that's your number one movement. And then your second movement is you can lay on your bed or on your yoga mat and just raise one of your legs off the floor. Next week, I'll have my mat here. But if I was on the floor right now, I would just do a straight leg raiser where you're laying on your back and raise one leg as high as you can, put it down, raise the other leg as high as you can. Straight leg raisers, what do? They stretch out your hamstrings, they make your low back flat, and they strengthen your lower abdominal muscles. So these guys right here and stretching out the hammies. As we get into the program, what we want to do is we want to strengthen your core. So from your thighs up to your chest, you hear that all the time now, core exercises. What really are they? You know, we'll cover them all. Which ones are safe for your back? Which ones aren't that great for your back? There's going to be some individual movements on all of you, because if all of back pain was exactly the same, then there would be a recipe that you would give to people and they would do it and they'd be fine. But there isn't. Each one of you has a little bit of an individual story and an individual problem. So we'll tackle that as we go along down through the way as well. So don't get frustrated with that. When people have back trouble, they do need to see their family physician. They do need to see the orthopedic physician, the neurosurgeon, the neurologist. You do have to go through that battery of people because the tests and measurements are very helpful. The x-rays, the MRIs, the CT scans. We do medically have to know, like, what do you exactly have so that safely you can go about trying to help yourself. So I'm going to turn it back over to Tammy, but the two homework pieces I'd like you to work on are, because it's going to be different for everybody. Think about your postures and positions. So you're a detective. What postures and positions alleviate your symptoms? And it could be standing, sitting, or lying down. That will help Tammy and myself in regards to designing an exercise program for everybody. And then the two safe exercises that everybody can do, and they're safe to do and they're good for our spine, is the standing back bends. You know, every once in a while throughout the course of the day, maybe about 10 reps a piece. Try to go backwards and not forwards. And then laying down on your yoga mat at home or your bed and doing your straight leg raisers. So the straight leg raisers, standing back bends, and then think about your postures and positions. And I'll let Tam take it from here. She's going to outline what we're going to be doing over the next 12 weeks. Thank you guys for logging in on a Sunday morning and listening to us. We're going to fight sometimes along the way. Try to bear with that. Tammy's always after me. You know, she tried to get me to eat salmon last night. I wanted to eat macaroni and cheese and brownies. So we're going to have some things here that we go back and forth with. You're going to have to tune some of that out. So hopefully I'll see you in about 2 weeks. Thanks.
All right, you guys, thank you for joining us today. So the program that Tom and I have put together, I'll quickly go over with you guys. So what we have crafted is in week 1, you have a one-on-one call with each of us. So to go over your specific diagnosis and problems, you know, we'll send you a survey before that call so that you can fill out the questionnaire. So we are completely prepared to answer any of your questions. So, you know, like Tom was saying, what positions give you pain? What positions don't give you pain? What is it in your life that you are having problems with? Is it going to work? Is it doing yard work? Is it doing your hobbies, golf or swimming, whatever you do that's giving you pain? So that's week 1. We just want to get a feel for what you guys do in your life, what gives you pain, what takes the pain away. Okay. And so that's an individual call that you'll have with Tom and I. And then going into week 2, we'll do group calls. So group calls will be every Tuesday night from 6 to 7. The first week of that, we're going to go over sleeping patterns. So Tom and I will actually physically go over each one of your diagnosis without disclosing your information, and show you how to prop yourself for sleep, show you different ways you can sleep on your side, your back, not so much your stomach, but if you are a stomach sleeper, we can work with that. And then in that same call, we're going to go over ADLs. So that's activities of daily living. So that's, how do you get in and out of your car, go up and down the stairs? Do you have trouble getting dressed? Do you have trouble tying your shoes, putting your socks on, getting in and out of the tub, whatever it might be for you? We'll hit those on that particular week. So that's week 2. Week 3, we're going to bring in a guest speaker, a nutritionist who's going to really get into the nitty gritty of inflammatory foods and really what it does to your body and why it makes such a big difference. Week 4, we're going to go over posture. So postures and standing, sitting, activities, and postural exercises that you can do every day to help your neck, to help your mid back, your low back. And then we're going to get into housework. So if you guys find trouble with vacuuming or bending over to put dishes in the dishwasher or getting laundry out of the dryer, whatever that might be, we're going to go through that with you. So that's week 4, posture and housework. Week 5 is a big one. It's yard work. So I know probably most of us struggle with that, right? So week 5 is going to go over if you guys have to do raking, shoveling, mowing, stacking wood, whatever it might be. We'll go over all of that stuff. What in particular bothers your back and causes pain for you. So Tom and I will come up with ways individualized for you guys to make that easier, or, have a problem solving when you go back in the house from doing that stuff. You have this game plan so that pain doesn't come attacking at night. Okay. Week 6 and 7 are modalities. So modalities to us are ultrasound, electrical stimulation, whether you want to try CBD oil or whatever it is that you guys, ice, heat, anything, any questions that you have tried, want to know more about, that's a pretty intense conversation. So we left 2 weeks for that. We also will hit upon like traction devices for your home, whether it's a low back traction device or a cervical traction device. And then week 8, we're going to go over work. If you go to work every day or what it is you're doing every day throughout your life, we want to address that. Week 9 is travel. So how many of us have trouble getting our suitcases in and out of the car, getting our suitcases on the belt at the airport, right? And just, do we pack our suitcases lighter or pack multiple suitcases so that we don't have to worry about how heavy it is to pick it up? We just want to touch upon things like that. These are all things that have come up with Tom and I. And so we've tried to strategically think about how to get you through every aspect of your life. Okay. And then week 10 is return to sports and activities. So whether it be like you have back pain when you're sitting there having dinner with friends at a restaurant, or you have your goal is to return to golf or tennis or whatever it might be, we want to touch upon that stuff. So that's probably another big one for you guys. You've probably had to put aside some of that stuff, right? So we want to make sure that you have ways to be able to still do the things that you love pain-free. And then the week 11, we're going to have a guest speaker in. So the week 11 is kind of about surgery. So Tom's going to bring in an orthopedic surgeon friend of his to have a conversation with you guys on that call. And so that's just in the event that you have to go down that path. We want you guys to have those questions answered, right? And if you don't want to go down that path, how to avoid that path, right? So we want to cover both of those options. And then week 12 is how we go forward from here. So when you guys aren't part of this group anymore, how do we live and keep going pain-free? How do we stay in that pain-free mode? So we want to get you to that point. We want to get you to Tom's point. And we want to get you to the clients that we've put through this program. So every time you guys have a game plan of, this is what causes me pain, and these are the things I can do to make sure that I don't get the pain. That's the point we want you to get at, right? So we want you to have that playbook, and that playbook is specific to each one of you. It's not a playbook that's just, you know, a one size fits all approach. We want to meet with each one of you individually to make sure that your game plan is your game plan. Okay, so that's the program that we have put together. So your 3 takeaways today, if you do nothing after this workshop, is how to decrease your pain, do what Tom said, your extension exercises, right? And do your straight leg raises on the mat. That's your decreasing pain. You're increasing movement. Don't stop moving, right? You guys, every day, do a little bit of something, whether it's walking or swimming, whatever your body can tolerate, just make sure that you're doing something, right? Don't just hang out on the couch and watch Netflix. It's not going to help your back at all. And then the nutrition piece. So the nutrition piece is decrease inflammatory foods and increase anti-inflammatory foods. Okay, so those are our 3 takeaways for you guys today. The program, I will email you guys. I did record this, so I'll email you the recording so you can watch this again if you'd like to. And then the program is 12 weeks. If you buy the program in the first week, it's $9.97. That's $83 a week for 12 weeks. So think about all of the times you've spent money on massage and co-pays and doctors and personal trainers and nutritionists and all that jazz. This is a one-time payment of a program put together for you, okay? So I'm going to leave this up for 2 weeks so that anyone who didn't get a chance to watch this that had wanted to come today can watch it. And the program we have set to start this time around is April 6th. So it'll go for 12 weeks from there. You guys feel free. You guys are welcome to unmute at this point. I'll call my partner in crime back here, and we'll take whatever questions you guys might have. And you can always email Tom and I questions. So you guys go ahead and unmute, and I'll call on you guys with any questions you might have. And it can be any questions. It can be about back. It can be about the program, whatever you guys want to throw our way.
Tammy, I just wanted to say hi. I haven't seen you in a long time.
Oh, hi, Tony.
Nice job.
Hey.
Very nice. Hi, Tom.
I'll take it.
What about me, Tony?
I just said hi, Tom. I'm a
Oh,
little bit
okay.
upset about your comment about the hair for men.
Yeah, hair club for men.
Does anyone have any questions, you guys? You know, I do want to say this too. I think that probably the biggest question that probably would come up from you guys is, how is this different from anything I've tried? And how is this different from physical therapy and what I've been doing? So Tom and I have left no stone unturned. We have put everything into this program that we could possibly think of, and we will address every question that you have. Even if we don't have the answer, we have plenty of people and contacts that we can get the answer. And if they're willing, we can always bring them in as a guest speaker as well. So that's how we've made this program completely different than the typical stuff that you have tried. And we'll cover every single base in your life, and specific to your life too. No questions, guys? We're a good audience. Lois?
Hi, Tammy. I miss you.
Hi.
Hi, Tom. You too.
Thank you.
I miss stories of those kids.
I know. Everyone misses stories of those kids.
Looking forward to this. This looks like something could really help me.
Yeah, it's a good program we've put together here. So yeah,
Thanks for doing it.
you're welcome. Thanks for coming, you guys.
We'll have some fun along the way, but now go ahead and join. Did you give your email address and stuff?
I didn't. I'm going to send an email to all of
So
them.
Tammy will send you an email address, and certainly if you have any beginning questions about anything, go ahead and email her, and she'll forward things on to me, and together we'll tackle email questions. If you want a kid story, every Tuesday, Liam, who's our age 6 kindergarten student here at Williams, the teacher wants the kids to come in with a joke. So I said, Dad, do you have a joke? And I said, well, ask the class, what do you call a dog in the wintertime? And then the kids hesitated, and Liam blurted out, a chili dog. And
Oh, God.
he came home and
Oh,
he said, Dad, the
geez.
whole class laughed. And I said, I got a million of them, Liam. You stick with me.
Tammy, what role does alcohol play in nutrition?
Minimum. So minimum amounts of alcohol, and it doesn't include stuff that would cause inflammation. So like wine, unfortunately, basically you're going to be sticking to like tequila and vodka.
I'll remove this photograph of those files pretty soon.
We're all out now.
2 glasses for women, 1 glass for men, and
Wait a minute.
No.
That's not fair.
I thought it was the other way.
It should be 2 and 2, or maybe 3 and 1. I don't know.
I'm not going to field that question because I'm Irish almost totally, and our sensibilities for how much dosages with alcohol. I better not answer any of those questions.
Right.
Is it the sugar or what is it, Tammy, that is a problem?
It's the sugar and the content of the sugar in the alcohol. Yep.
Okay.
It causes inflammation, beer, wine, any of that stuff. Any of the whiskeys, bourbons. It has a high sugar content, and sugar is one of our main enemies.
Okay.
Yeah.
Thank you.
You guys, I thought somebody would have a question about CBD oil here for Tom, but no takers.
Well, what do you have to say about it, Tom? I've been taking it every night for quite a while.
Yeah, we'll get into CBD oil when we get down to the part of where Tammy mentioned the word modalities, because we want to spend probably almost 2 different sessions on all the things that we've all tried to use if anybody has any type of back pain, and which I'll talk about CBD in a second, but I've had like neurosurgeons come into the office. So the top medical person that we have in the medical realm is a neurosurgeon, and they come in for physical therapy for their back pain. And what I've learned about back pain is I don't care who has it. It can be the highest level neurosurgeon or just the everyday regular person. Everybody actually has the same questions in regards to how do I get rid of my back pain? Because back pain just immobilizes you so much that, how can I get rid of it? So CBD oil. I always tell my clients that it's worth a try because we know that it can't hurt you. I never like to see people spend a lot of money on it now. There's CBD oil, interestingly enough, is so new that really nobody knows a heck of a lot about CBD oil and helping. We know it doesn't hurt. In my 40 years as a physical therapist, seeing people come in with all sorts of things that they've applied to themselves, CBD oil so far has been a minimal effect. It does help. CBD actually helps in certain problems, but not necessarily low back pain. But again, they haven't done a lot of research on that, and there's a reason why they weren't allowed to study it because it was considered marijuana was considered a level 1 drug, and the government couldn't do a lot of testing on it until just recently, when now in some states it's become legal. And so I observe the people who come in my office, and I don't see anybody really saying that it helps a lot. And again, if it helps a little bit, then to me, that's okay. And that's why we wanted to tackle spending a good amount of time on what does help. What do we put on our backs or our pain, whether it's Bengay or Icy Hot or Thermopatches or BioFreeze or CBD oil. What things actually help? And then you guys, maybe when we're talking about these things, you can tell us. I keep a sharp ear to now that we live in this day and age, 2021, almost everybody is applying CBD oil to pretty much any part of the body that hurts. And that to me is, and no one really says that it's helping a lot. So I can just pass that on to you. And then I don't want to say anybody spent a lot of money on it, but it would be impossible that one thing like CBD oil, one thing would help everything. So I think our society's gone a little bit, flip side on it, where it's like, I hope this helps me. And I don't blame people that put it on. My mom actually is 90 years old. She's in a lot of pain at this stage of her life. And she has a lot of aches and pains around her low back and hip. And one of my orthopedic friends, I was just telling Tammy, my orthopedic surgeon roommate in college, he said to me, hey, have you tried, putting CBD oil on your mom, on her hip and her low back? And I said, we haven't done that yet, but I'll do it. I'll try it. And I said back to him, I go, gently, and only because he's a great friend, I go, how would it help? How would it help? Because there's no medical evidence that it would help. However, it couldn't hurt. And so I will probably try it on my mom, but there's been no scientific research or paper, except for those put out by the marijuana companies, that would say that it would help. And I'll get into that. I'll get into that deeper. I've done some research on that. It's sort of a deeper question, but I'd like to tackle the CBD, the marijuana thing itself, the actual molecule of how marijuana or the CBD part of marijuana would help us if that were to be the case. The good news, though, is I know it can't hurt us.
A little more placebo.
When they test drugs, 30% of the people say they felt better when they received the placebo. So,
Right.
And
Positive thinking.
there might be a little something in the molecule that we rub on with CBD oil, maybe, but the research about that is that it's not even going to interact with the neurotransmitters that would help decrease our pain. So I'm a little bit skeptical, but I'm also open-minded, because when I started doing the readings on marijuana for musculoskeletal issues, they really haven't done a lot of testing on that yet, because again, the history behind it is kind of confusing, but it was deemed a level 1 drug by the FDA, and thus research companies couldn't do a lot of research on it until just recently. But the actual ingredients of CBD oil so far have not been necessarily effective on neuromuscular or musculoskeletal things. And I think some of that is because they haven't done a lot of testing on it to give us the information. And I can only tell you as a clinician, like almost everybody puts it on their body these days. And I haven't seen it. I wish it was. I haven't seen it to be any more beneficial than the things that we all get to use in our offices, whichever one, a physical therapist or a chiropractor or whoever's using different ointments to help ease our symptoms. I find the Thermopatches and the BioFreeze and maybe some types of, not Bengay necessarily, but some of the ointments that all of us use are probably as effective as a CBD oil, but that's why the program is 12 weeks. Let's spend some time on that. And even if we have to bring a specialist in on CBD, we will. BCC, Berkshire Community College, they teach a course now on CBD and its effects, because so many people have to be knowledgeable about it, because we have stores that sell it. You know, we have stores in Massachusetts that sell marijuana, so we actually have to be more knowledgeable about what we're all trying to buy. But it's a good question. We'll cover it even in greater length. Thank you.
I have to go, folks, but I just want to say that I spent a year doing Pilates with Tammy, and it was a wonderful experience. And I've used a lot of her exercises since we stopped on a regular basis every morning to kind of loosen my body up and do some of the exercises that Tom, you talked about. So I really appreciate your doing this, and I'll see you around.
Thank you.
Thanks, Peter.
Thank you.
Okay.
You guys, any other questions you want to throw our way?
Tammy, while we're going through this 12-week program, do you recommend ice or heat for
So
pain, or both?
it can be both, but it depends on what the injury is and how old the injury is. So typically, ice is more of an acute problem. Heat is more of a chronic. Do you have anything?
Yeah, I mean, that's how I would answer it as well. If the pain is old, which most of our back pain things are, then some people get good relief with ice right before they go to bed, because it helps decrease pain, and heat to sort of warm yourself up. So I think the typical back pain sufferer probably takes a shower in the morning, lets the hot shower hit on there, and then somewhere during the course of the day, ice it. If all of a sudden we get an acute episode of low back pain, it's pretty wise to ice it for the first 72 hours and then to heat it up. But then once pain has become an old thing, both heat and ice, they both help on the pain receptors in our body. Ice is a vasoconstrictor, so it constricts your circulation, and also helps decrease a little anesthesia to your free nerve endings. And heat increases the circulation. So both can be used in conjunction when somebody is almost like, I hate to use the word chronic back pain sufferer, but for those people who have back pain a long time, then either ice or heat will be a helper. And then also the last thing about that is, depending upon the season of the year, sometimes it's no fun to put ice on your back in January, and it's no fun to put heat on your back in July. So sometimes the seasons make a little difference as well.
Thank you.
Yep.
All right, you guys, if there are no other questions, I'm going to let you guys go enjoy your Sunday afternoon. I'll email the Zoom video so you guys can watch it again if you like. And I'll email you what we put together for a program. And feel free to reach out with any questions, whatever you might have. And the program starts April 6th if you guys are wanting to join us. All right.
Thank you.
Have a good
Thank
day.
you.
Down
Yeah,
the road. Thank
thank
you.
you.
Picking Gonzaga, Tom.
All the way. Gonzaga. Hope so. One timer.
I want to ask you a question. Tammy,
Yeah.
Yes,
what's the price again?
$9.97. For
No,
12
No.
So
Okay.
being $83 a week.
Okay.
All right.
Okay.
So,
you.
Thank you.
you guys
Thank
have
you.
a
Bye,
good
guys.
day.